Dr. John Hovannisian is with us right now from Harvard Eye Associates. Good to see you.
Nice to
Always
see you
good.
too.
Happy New Year to you.
Always good to be here. Great to be here.
Yeah, and today we're going to talk about something that people may not think about being in the winter months.
Yeah.
But dry eye can affect people more in the winter than sometimes even the summer because one, especially on days like this, you have we're going to have some Santa Ana winds coming up over the next couple days. So it's cool, it's dry, you go inside, and now you're in a totally different condition where it could be quite literally 30 degrees warmer inside or something.
Oh, well, there's that. That's right. And when it's colder, you know, every day of the year we have dry eye problems here in Southern California because when it's colder, you've got artificial heat on in your car blowing hot, dry air in your face, and the same thing in your home.
Right.
And so, and of course, in the Santa Ana conditions, you get not only the hot, dry air blowing across the land, but you get all the dust and all the pollens and all the stuff from the desert that comes here and creates terrible problems for people. So when we see Santa Anas, we know people are going to be somewhat miserable.
Right.
So
and they will be coming up over the next couple days. And first of all, a lot of different things can cause dry eye. I mean, what we just talked about can be environmental, and something like that may be nothing more than temporary.
Yes, yes, and of course that waxes and wanes. It comes and goes.
Yes.
Age, of course, marches on, as we all know.
Yeah.
Hormonal changes can fluctuate as well throughout time and affect the way we feel from time to time. And of course, medications that we take only can add to it, particularly blood pressure medications, some antidepressants. There's a whole class of medications that can, diuretics, you know, can make folks have awfully dry eyes. And of course, other diseases, people with arthritis or autoimmune disease, thyroid disease, are often more prone toward dryness of their eyes.
So there are a lot of causes.
Yeah.
And again, some of those may be temporary, others it could be chronic as well, right?
Yeah, and so it's all kind of dogpiled on top of each other, these risk factors, and that's why some people have seasons of the day and the year and seasons of life when they are more or less symptomatic. And you know, there are a lot of simple things people can do to lessen their symptoms, and we always try to focus on those easy things.
Right.
A lot of times we'll hear patients say, hey, when I go outside, that's when I have this problem with my eyes watering. And it's because they don't realize it, but their eyes are just sort of borderline dry. And they have enough tears that they can withstand the normal dry environment in their home, but if you step outside and there's wind blowing, that irritates the eye, and then the eye floods with tears. And so the symptom they notice is their eye watering, but the underlying problem is that their eyes are dry. And so what can you do about it? Well, one simple solution is kind of wraparound glasses. Just when you go outside, wear some sunglasses that have a good wrap design.
Right.
Or they can be clear. We even have some patients who do this inside. And of course, the other is lubricant drops. There are lots of lubricating drops that you can get without a prescription. People call them artificial tears. The technical term you'll see on every little bottle in small print is lubricant drops. Okay,
and these are different brands. All different ones that are out there that, again, you walk into wherever, Target or the pharmacy, you know, wherever it might be, and they're going to be there.
There's a whole rack of these things, you know, several shelves in many cases. And people ask us all the time, which one should I take? It's a little bit like moisturizers for your skin. There's not one answer for everybody. You have to sort of try different things to see what works. There are thicker ones, and they tend to last longer, providing more lubricating effect, but they also blur your vision more. There are thinner ones that don't last as long, but don't tend to blur vision as long. So, you know, and then there's the comfort factor, whatever sort of feels good. We often tell folks that if they really need them a lot, if they're going to take lubricating drops more than maybe 4 times a day, it's good to get a preservative-free one. They're more expensive, but they don't have the irritating effect that preservatives and the allergy-producing effect that preservatives sometimes can produce.
That's a good thing to look for. Now, is that on different brands? It's right there on the front or something, or do you need to go to the pharmacy to get that?
No, you can ask the pharmacist for guidance and for advice, and often they know a bit about them. But it'll be labeled pretty clearly that it's a preservative-free type of lubricant drop. And they tend to be more expensive because they're packaged in sort of single-use little tubes.
Oh, yes. I've seen those.
Yeah, those tend to be the preservative-free.
Okay. We always ask about this when we talk about these type of drops here. and those are the get the red out Visine type drops.
Generally, you want to avoid those because generally those will cause most people to have end up having more redness in their eyes than without.
Okay.
The redness reliever causes the blood vessels in the eye to shrink, but then of course they come back later, and they come back with a vengeance.
Okay.
So the eyes often are red later. So what people do is they take more drops, and they think that'll work better, but it ends up making them worse. So,
Okay.
Yeah.
So this is a good one to look at, the tear chemistry.
Yeah.
People think it's just, water
And
and
salt,
salty
right.
water.
Yeah, that's right. And that's why different drops work for different people, because the layers of our tears and the chemistry of our tears is very complicated. It is made of mucus that's produced by one set of cells, and water produced by other glands, and oil. And the oil, it turns out, is really important for the tears and for having comfortable eyes. Not just because it lubricates, but because it forms an oil slick over the surface of the tears. And that, because the oil doesn't tend to evaporate, that traps the moisture of the tears inside. It keeps our eyes from having evaporation of our tears.
Right.
When you think about it, your eye is this surface area covered by a very thin coating of tears. How do we keep that from evaporating so that you don't have weird irregularity in the surface that would make you not see well? Well,
Right.
the oil serves that purpose. So if you're
Okay.
deficient in the oils that are produced in the eyelid glands, you're in real trouble. And we have some pictures of that as well.
Okay, so there comes a point in time that this becomes chronic, is they want to come to see someone like yourself, and that way you can find out, is this the oil, the lipid as it's called here,
Deficiency, yeah.
rather than just, a case of you got some dust in your eye or whatever it might be.
Yeah, and if we can advance that slide, maybe
Yeah.
one more, we'll see a picture that shows what it looks like. So in a normal eyelid, there are glands shown in green on the left that are, we call them meibomian glands. And
Okay.
really commonly, we'll see that these glands get stopped up. Now in the right picture, you'll see the tips of these glands, these little whitish spots on the edge of the eyelid. That's where the glands are emptying into the tear film.
Okay.
And normally you won't see them so prominently because it's like vegetable oil. It looks very watery coming out. That's a normal eye. Here it looks like toothpaste. You can see it curling up, and this is a really bad case of someone whose glands are not producing oil. They're producing, butter basically.
Oh, okay.
And so, that doesn't work well. It doesn't
Right.
make a nice oil slick. And so warm compresses can help a lot because it actually melts those secretions, and it also just kind of massages a little bit to empty those glands. Some people actually scrub the eyelids with wipes that are made for this purpose.
Okay.
We have other advanced treatments like LipiFlow. I think we have a picture of that
Okay,
as well.
we'll go to the next one and look at
which
the
which shows the the way that works. LipiFlow is basically one of the treatments we use in the office when everything else fails, that helps to express the glands, to help them to drain themselves so that they will not leave a lot of material.
So is the LipiFlow, is this, pardon me, is this a brand name? Like, what's the brand name you hear? Restasis or something like that has to do
Yeah,
with?
great question, and it's worth a second on that. Restasis is a medicine that's great. It's been around a long time, works to treat dry eye, and there's a new one actually approved just last year called Xiidra, Xiidra. A lot of people have seen I Love commercials on TV.
okay,
Jennifer
yes.
Aniston
Yes,
is their spokesmodel.
exactly.
And that's all about Xiidra. The I Love commercials don't say the name Xiidra because they're not allowed to, but the Xiidra is a new drug and it works fairly well.
Okay.
It's not entirely different from Restasis, but it seems to work faster, and in many people who don't get a benefit from Restasis. LipiFlow is more for specifically the oil problem.
Okay.
And it's a treatment where in the office we use a device like this that rests on the eyes, and it applies heat and it applies gentle pressure to the eye to cause those glands to flow. Okay. And for many people it'll give relief for 2 or 3 years, believe it or not.
Really?
80% of patients
Wow.
get meaningful benefit from LipiFlow treatment.
Now, going back to the Restasis and the other one,
Yeah.
Are they injections? Are they drops?
Just eye drops.
Just eye drops,
Yeah.
okay.
Taken twice a day, and they're
Okay.
prescription, so you can't just get those at the pharmacy.
Okay.
And they're for people whose dry eye can't be managed by the simple things we talked about first.
Okay. But this, is it one treatment?
Yep,
or-
it's one treatment. It takes about 12 minutes in the office. And what we think it does is by getting
Wow.
those glands to empty themselves, it sort of jump starts the process again. Takes those
Right.
glands filled
Okay,
with
I
that
understand
gunky
that. Yeah.
stuff, empties it out, and then allows the glands
That's
to
amazing.
produce more healthy, normal oils. And you know, by itself, it may not work as well as with warm compresses and other things that you can do. But we've had quite good success with it. It's like a procedure, but it's more like a spa treatment, patients say. And there's a cost to it that's not covered by insurance, so it's not for everybody. But it's a helpful treatment that we have found and used now for about 4 years in our practice.
That's nice.
Yeah.
And to have it last that long, that's incredible.
Yep, we've seen some nice long-term results. Some patients have told us that, you know, until they had LipiFlow, their lives, you know, were different, and they just got their lives back on track after treatment.
So at what point in time should someone realize that, you know, this isn't just a temporary, this is not being caused by the Santa Ana winds or something?
Yeah.
It's ongoing. I'm waking up every day with itchy eyes and all this.
Yeah. You know, if you're over 55, you should be probably having an eye exam every year.
Right.
And so part of that exam would be telling your doctor about the symptoms you have. And then, you know, the doctor will have an opportunity to tell you what level of treatment would be appropriate based on what they see.
All right.
Yeah.
Yeah, definitely. But again,
it's a dry subject, but it's one that's really, really
there
common.
We go.
Right?
Well, it's great to see that it may be just as simple as buying those lubricating drops.
Very often.
And there is definite treatment for it. So
You bet.
That's really good.
It's very treatable. Nice to see you.
Good to see you, Doctor. Always
Thanks
good to
so
see
much.
Dr. John Hovannisian, Harvard Eye Associates. And again, get your eyes examined. Just in general, it's always a good idea because that examination can even find high blood pressure and all kinds of different things. So, all right, good to see you, and we'll be right back.